Joining me now is Dr. Kavita Patel, former health policy director in the Obama administration, and is on the front lines administering doses and seeing how people react. Dr. Patel, there has been a long wait for this. Long, of course, not in the terms of the way vaccines usually come online, but what we've been waiting for is a single shot, doesn't require great refrigeration, can get into rural areas. And you see that UPS truck is already at the airport.
I know, Andrea, it's a great sight to see. I'm so happy that Ellison was there to cover it. I think something also that's important, because it's one shot, we know that immunity starts, Andrea, 2 weeks after that dose is administered, which is huge when we're up against this race with the variants, which are more transmissible, possibly more deadly.
And the fact that 15% of the trials were done in South Africa, so they've got a pretty good handle on its efficacy against that variant.
Yeah, that's right. And we believe all three currently authorized vaccines, Pfizer, Moderna, and now Johnson & Johnson, offer protection, even if it's a little lower than the protection against the variants that were found in the United States. But these are moving targets. These trials were done for all three manufacturers across different continents at different points in time, as you heard the CEO say. So I do think that it's important to note that if all the other manufacturers were trying to reproduce numbers now, we'd probably see similar efficacy numbers. Bottom line, though, this efficacy threshold, 66%, 72%, still exceeds what the FDA was looking for. These are still very powerful and effective vaccines.
Do you think with more coming online now, they can finally start their public relations campaign to try to reach resistant communities?
Yeah, Andrea, look, I don't think it's never too early to have clear messaging, no matter who the audience, because I think we have a lot of people who are not necessarily, quote, hesitant, but like my patients who want it, but they have a lot of questions. So I don't think it's too early. I think we need to get out several key messages that whatever vaccine you're offered, the sooner you can get it, the better. I think Americans, I were frustrated. We can't get them. Those trucks will mean it's going to be a little easier, not a lot. And then, Andrea, in April, a lot easier. So now is the time. And I would even say it might be a little, I wish we had done this months ago, gotten people ready to understand what these vaccines are and what they are not. And giving people some hope that if you are vaccinated, you are going to be able to get together with other people who are vaccinated soon. And that's important to note, even before we get to herd immunity.
Indeed. Now we got to get those websites fixed. Thank you very much, Dr. Patel.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.